On October 14th, Kaiser Permanente began facing one of the largest healthcare strikes in its history. Over 46,000 employees, including nurses and care professionals, walked out across California, Hawaii, and Oregon. The headlines cite wages and staffing shortages, but the deeper issue runs beneath the surface. It's about engagement, equity, and trust. While Kaiser has acted swiftly, offering wage increases and maintaining patient care, the moment reveals a larger cultural truth. Operational excellence alone isn't enough. Organizations also need cultural health. That's where we come in. My name is Judy Parrish McMaster. I'm going to pass this off to Nina, who's going to share more about what we're going to talk about today.
Thanks, Judy. I'm Nina Labata, and today we will be discussing why Kaiser Permanente, a leader in integrated healthcare, should partner with SpectrumWorks to advance workplace inclusion for neurodiverse individuals and create healthier communities as a whole, both within and outside the organization. My friend Amanda will give a brief overview of our agenda for today.
Yeah, thanks, guys. So, our agenda for today, we're going to talk about the background of Kaiser Permanente. This is going to include the history and purpose, their approach to communication, their theory of management, and also the organizational culture. Then we're going to get into our nonprofit partnership, which is going to be SpectrumWorks, and then our call to action, which is going to talk about next steps and just the future of this partnership. So, a little bit about the history of Kaiser. So, it starts in 1930, where Dr. Sidney Garfield opened a small hospital in the Mojave Desert. And this was to serve the workers that were building the Los Angeles Aqueduct. And workers couldn't afford healthcare. So, Garfield created this prepaid health plan where they would pay a few cents per day for their full medical coverage. This became the foundation of Kaiser Permanente's model, which is a prepaid group practice medicine. And then we go into the 1940s. This is around World War II and the Kaiser Permanente startup. In 1942, industrialist Henry J. Kaiser hired Dr. Garfield to provide healthcare for thousands of workers that were building the ships for World War II. And together they launched the Kaiser Health Plan for shipyard and steel workers. It emphasized preventative care and affordable access to all workers and families. Then we go into 1945. This is after World War II ended. Garfield and Kaiser opened the plan to the general public. It officially created Kaiser Permanente, and it also became one of the first examples of an integrated managed care system in the United States. Then we hop over to the 1950s to the 1980s. This is where we see a lot of growth and expansion. And Kaiser Permanente expanded across California, Oregon, Hawaii. And the organization really pioneered electronic health records and data driven care concepts long before they were common. Kaiser began investing heavily in research, education, and community health programs. Then we go into the 1990s and 2000s. This is where we see modernization and more technology. And Kaiser really implemented one of the first large scale electronic health record systems. It expanded its network to hospitals, clinics, and telehealth services. Continued to lead in patient centered, technology driven, and cost effective healthcare delivery. Now, in the 2010s and 2020s, there's a lot of innovation and public health leadership. They are focused on public health, mental health access, and social determinants of health, such as housing, nutrition, and just community wellness. They invested in sustainability and diversity and equity and inclusion initiatives, and they also played a major role in the COVID-19 response when it came to vaccination distribution, as well as virtual care expansion. And Judy's going to talk more about the approach to communication.
Yeah, Kaiser Permanente uses a hybrid communication model that blends four approaches: information transfer, transactional process, the strategic control, and creativity within constraint. This balance enables clarity, collaboration, innovation across one of the nation's largest integrated health systems. Information transfer treats communication like a pipeline, clear and efficient. For example, Kaiser's secure patient physician messaging system lets doctors send results and follow ups directly through the electronic health record. Yi Zhao actually conducted a study of over 35,000 patients with diabetes and hypertension, or both, and they found that this tool actually improved care quality and reduced unnecessary doctor visits. Similarly, during the 2014 Ebola crisis, Kaiser distributed rapid safety protocols through top-down memos, one-way communication built for speed. The transactional process emphasizes two-way understanding and feedback. Programs like Roadmap to Home, bedside boards lets patients and nurses co-create discharge goals, while Culture Crew initiative fosters dialogue between leaders and staff. For Kaiser, effective communication builds relationships as much as it delivers information. Through strategic control, communication aligns behavior and reinforces trust. Preventative health campaigns such as mammograms and flu shot reminders actually help use persuasive, evidence-based messaging to prompt action. During crises, communication teams balance transparency with stability, sustaining organizational credibility. Finally, creativity and constraint encourage innovation within clear boundaries. Tools like IdeaBook platform lets employees share ideas system-wide, while patient engagement boards keeps messages consistent with Kaiser's brand and ethical standards. In short, Kaiser Permanente's hybrid model shows that communication isn't just about sending messages, it's actually about connecting to clarity and collaboration and purpose to achieve better outcomes for patients and employees alike. Now, let's get into the theory of management approach. Off to you, Nina.
Kaiser Permanente utilizes the human resource approach when it comes to the theory of management. Now, a little background on exactly what the human resource approach is. It concerns the organizational climate as a whole of a company and strongly encourages employee participation and dialogue. So I've included here some examples of this being implemented in Kaiser's workplace. So first is the prioritization of a collaborative and inclusive staff. This is when differing levels of staff are encouraged to join BRGs, which are business resource groups, which are meant to build community and connect with others across various parts of the Kaiser workforce. Second, encouragement of participation and development. Employees' feedback and participation are strongly encouraged. This is done through anonymous servers or direct report rounding. These are strongly encouraged as a part of Kaiser's overall model. Lastly, we have the emphasis on holistic well-being over interpersonal satisfaction. So employees are encouraged by Kaiser's mission statement, where they claim to exist to improve the overall health of the members and the community they serve. This can be motivating for staff to be able to provide this sense of fulfillment and purpose for the employees. Now, since we've covered what theory of management Kaiser Permanente uses, Judy will be able to give us a sort of inside look on what cultural elements Kaiser Permanente uses as well.
Thanks, Nina. Kaiser Permanente's culture powerfully reflects its mission to provide high quality, affordable care and improve the health of communities it serves. What matters, what makes Kaiser unique, is how it lives this mission through the 7 interconnected cultural elements: metaphors, rituals, stories, artifacts, heroes and heroines, performances, and lastly, values. Let's get into it. So metaphors. Metaphors capture Kaiser's identity as a connected, healing-centered system. Phrases like one-stop shop for healthcare or anchor to the point of care reflect how every part of the organization works together for holistic well-being. For rituals, they represent acts of alignment, reflection, and gratitude, from bias and equity huddle cards to Schwartz rounds and nursing leadership of DMS, which stands for Daily Management System, turning communication into a healing practice for both staff and patients. Stories such as Thrive and Care Stories, which are featured on their website, are campaigns that highlight compassion and teamwork, reminding employees why work matters and also strengthening a sense of shared purpose. Heroes and heroines, just like the founders, Sidney Garfield and Henry Kaiser, along with generations of nurses and clinicians, embody innovation and care in action. Performances such as town halls, safety celebrations, and community volunteer events transform equity, excellence, and compassion into visible, shared experiences. And finally, all of these elements are grounded in Kaiser's core values of integrity, compassion, collaboration, stewardship, and total health. Together, they create a culture where healthcare isn't just a service, it's a moral responsibility to care for people, the planet, and communities. So, while Kaiser has made impressive strides in healthcare and inclusion, there is still a growing need that aligns perfectly with its mission. Nina will actually dive deeper into the problems at hand.
Yes, thank you, Judy. So the issue we will be focusing on today is the employment barriers that neurodiverse individuals face today. According to a study conducted by the Advanced Autism Services, an estimated amount of 85% of people on the autism spectrum are both underemployed and unemployed. Additionally, 15 to 20% of the global population consists of neurodiverse individuals, which kind of just puts that into frame for you. There are neurodivergent individuals who face stigma and ineffective inclusion policies, and often are excluded from traditional hiring policies because they just don't fit the look to them. Often, this results in social isolation, mental health strain, and untapped potential. So, what does this mean for Kaiser, and how can they address this issue? Well, they can partner with an organization that aligns with Kaiser's goal of improving community health. Employment would entail financial stability, purpose, and belonging, and social connection. This would also be improving the community's overall well-being, which is, as I've said, a part of Kaiser's mission statement. Expanding employment to implement neurodiverse individuals would be implementing business needs as well and decreasing both unemployment and underemployment rates. So now that we've covered the issue at hand and how Kaiser can address it, Judy will be able to expand on what exactly SpectrumWorks is.
Thanks. So, SpectrumWorks is a nonprofit organization dedicated to increasing employment opportunities for autistic and neurodiverse individuals. Only 15% of autistic adults are employed, and SpectrumWorks works together to change that by providing job training, sustained employment support, and helping companies build inclusive workplaces. They partner with businesses to tap into a pipeline of focused, loyal, capable employees, all while meeting DE&I goals, reducing turnover, and enhancing company culture. Next, Amanda's going to go over how Spectrum works in further detail.
Yeah, so first we're going to start with the partnership setup. So Kaiser is going to partner with SpectrumWorks, and they're going to identify the inclusive employment pathways for these individuals. Then we're going to go into the training and preparation. So on the SpectrumWorks side, they are going to train their neurodivergent candidates in specific fields. And then Kaiser, they're going to have their staff learn the best inclusion practices if they haven't already. Then we're going to go into candidate placement. This is going to be where qualified candidates are placed into roles that best match their skills and experience. And just to support them and have more continued growth, we're going to recommend some coaching, feedback, and just regular check-ins to ensure that there is long-term success with this partnership. And then we're going to talk about more so of the benefits as well.
Thanks. So partnering with SpectrumWorks gives Kaiser Permanente a unique opportunity to live out its values of equity, excellence, and total health. Through this partnership, Kaiser can access a pool of loyal and dedicated employees who bring exceptional focus and innovation to their roles. You've heard me say it, and I'll say it again. Most importantly, this partnership expands inclusion beyond policy and into practice, reinforcing Kaiser's reputation as a national leader in compassionate, community-driven care. During a time like right now, with this massive strike taking place, this would be a good opportunity for Kaiser to showcase its commitment to improve not only how they compensate their employees, but how mindful they are about their inclusive and equitable practices. Next, Nina's going to go over some things that Kaiser needs to look out for.
Yeah, thanks, Judy. So as we mentioned in the beginning of this presentation, thousands of healthcare workers are on strike, and this strike kind of displays how important organizational culture is in the midst of this in regards to Kaiser's long-term success. because it affects both patient care and community trust. In partnering up with Spectrum Works, it gives Kaiser a chance to rebuild the public's trust and develop a more inclusive, community-based workforce. It shows that it's possible. Furthermore, it also signifies change to those on strike. It displays how the company can show support and how it can empower its employees. Along with this workforce problem, there are also some positive effects that can appear, which will be covered by Amanda.
Yeah, so to visualize this in the future, to be more positive and the ripple effects, we're going to look into how this will be expanding their opportunities. And this creates meaningful jobs for neurodiverse individuals. It'll also inspire inclusive hiring industry wide, not just within Kaiser. And because of this, it'll also build a stronger workforce culture. It will build empathy, teamwork, and innovation across Kaiser's departments, and not only Kaiser's departments, any other healthcare that takes after this partnership. And it also build a healthier community. So stable employment boosts mental health, purpose, and community wellness, which will be better for everyone. And to look at the broader social impact, this will put Kaiser in a position as a national leader in equity and corporate responsibility, which will ultimately build credibility for them. And some lasting ripple effects. So each success story from this partnership will create more momentum for lasting social change, which is a very positive thing from this partnership. And then I'll pass it back off to Judy.
Thank you. So Southern California, specifically Orange County and Los Angeles, is the best location for launching a pilot partnership with Spectrum Works. This region houses Kaiser's largest workforce and most diverse patient population, creating a perfect environment to test and measure inclusion outcomes. Most importantly, piloting here honors Kaiser's origins, proving once again that innovation and equity can start right now. The organization, where the organization began, and then scale like nationwide. What should Kaiser do next? I'm going to pass this off to Nina, who will go over this.
Thanks, Judy. Yeah, so I have 3 specific steps to success that we can follow in order for this to be a success. So first, begin with a joint task force between Kaiser's DEI leadership and Spectrum Works. They can form this task force, which can consist of inclusion experts from Spectrum Works and clinicians from Kaiser, and develop ways to accommodate and raise awareness for neurodiverse people who are a part of this project. Second, establish a small hiring cohort of neurodiverse employees through the Spectrum Works program. This would be establishing a hiring cohort consisting of 10 to 15 neurodiverse candidates that are placed in various departments across 1 or 2 medical centers. And lastly, publicly sharing results to inspire other organizations and reaffirming Kaiser's leadership in healthcare equity. This highlights success stories and even maybe releasing a joint case study positions Kaiser as a model for inclusive employment in healthcare. Now, let's go over the key points that you should take away from this presentation. Firstly, the issue that is addressed. Unemployment and underemployment of neurodiverse individuals is an issue we should all be aware of, especially healthcare professionals. Their potential is often overlooked because traditional models of hiring often overlook their strengths. So what can we do? Well, we can partner with Spectrum Works. This provides support and employment opportunities for neurodiverse people who are in need of a job and in need of kind of refining the skills they already have. This aligns with Kaiser's mission statement to improve community wellness. And it also has a broader impact, which is my last point. It encourages a more inclusive culture and helps foster the public's trust. In a more faith-based way, it displays Christ-likeness to others, to care for other people in the way God would want us to. And I'll pass this on to Amanda for our final thoughts.
Yeah, so we're focusing on building a healthier and more inclusive future. And by partnering Kaiser Permanente with Spectrum Works, it'll bridge the gap between healthcare and inclusion. This proves that wellness extends beyond the physical health purpose and it'll go into the more of the patient's purpose, their opportunity, and belonging. And so, more of like a shared vision, Kaiser is committed to improving the health of communities, and Spectrum Works is dedicated to empowering neurodiverse individuals through meaningful employment. So, together, they can redefine what community truly means. This impacts everybody because it will promote diversity, equity, and inclusion in the workplace. It'll strengthen mental health and community connection, and then it'll inspire organizations to follow this model of compassionate leadership. So I want to leave you with the thought that when we invest in people of all abilities, we build a future where every individual can thrive and every community becomes stronger. Thank you.